Dr. Mohamed Elfar is a plastic and reconstructive surgeon. He's part of the American medical team with Rahma Worldwide. It's an independent humanitarian organization. Joins us now from the European hospital in Gaza. Good to have you with us. So, first of all, tell us about reports of people dying because of a lack of basics, medicine and equipment.
That's absolutely true. Just a couple of nights ago, we heard the ambulance coming in. Myself and a few of my colleagues from the team, we ran down to the ER. And we had a young guy that we tried to resuscitate, but unfortunately, there was nothing that we could do to help him out. There's no basic medications for resuscitation. There's no equipments. There's no ultrasound. There's no lines to resuscitate. So we end up losing a soul because of that. And that shouldn't have happened, to be honest with you. Not in the 21st century and shouldn't happen anywhere in the world. Assuming that we apply the same standards everywhere in the world. So the situation is really dire.
You're right now in a hospital in Gaza. When's the last time supplies reached you?
The last time we had supplies were when we came in. This is when we brought some supplies with us, medications and equipments. But of course, we ran out quickly. And right now, and as I mentioned before, yesterday I had to do surgeries without having a gown on, just have gloves on. And I can tell you, this is definitely going to lead to an increase in the infection rate and probably, mortality and morbidity among patients. So we are in a crisis situation. We've been asking for more and more supplies. Every day I get a whole list from a different department that I try to provide to the Rahma organization in Chicago, so they can at least give us more medications, more equipments, more supplies, just to keep the basic service going.
You mentioned there you're asking for more supplies, and allow me to ask what might appear to be a pretty obvious question, but who are you asking and what answer are you getting as to why, if you are getting any, who's stopping or preventing, or why you're not getting the supplies you're requesting?
So the restrictions are there. However, the way I look at it is the request is way more than what we can provide on a short-term basis. So I have a list of about 5-6 pages just for one department. And to bring this in, it's going to take weeks and weeks of logistics and coordination and shipment, et cetera, et cetera.
Why, Doctor?
Time is an essence
just to explain
situation.
to people who might not understand, you have a list, you need equipment, you need medicine. How do you request that? Who do you go to say, I need this?
So basically, I email, I'm sorry, not email, I text this to the Rahma, the organization that we're on here through, and they buy donations and they start looking into providers for these equipments, either from local agencies like in Egypt or in the United States. And then by the time we put the order in, and by the time we ship things down, and by the time we have the next team coming in to bring the stuff with them, we're looking at weeks. So this is not practical at all.
Why can't it come in through the channels where medicine used to come in? Explain that to viewers. We've heard there's plenty of supplies at the border.
I don't think these channels are working efficiently. I mean, we were able to bring in medications and equipments after we had, going through the right checkpoints and the right agencies and approvals. I don't think just bringing in supplies by itself or equipments by themselves would be feasible just to ship them through. There's a lot of no-nos, there's a lot of restrictions, and not everything is feasible to bring in.
What about the shelling that's going on? I mean, you've come from the US, I understand. How do you deal with that possibility that when we're hearing medical staff in some cases are dying, that you may be facing yourself a life and death situation.
We are trying to separate ourselves emotionally, but I personally, and I'm sure many of my colleagues get emotional at many points when we felt that we had a patient that we're treating and they should be cured and recover. And when we come to around on the next day, all of a sudden we hear that they just died because there was a missing equipment or a missing medication or a missing care. Let me give you a very simple example. None of the patients in the ICU that we operate on do have any kind of nutrition. They don't have any kind of nutrition. Food is scarce. Families are not able to provide any food to the patients, and we're not able to give them any food. So not to put any nutrition in a patient equals death. It doesn't matter how good your skills are. It doesn't matter what good your surgery is. Unless the patient is being fed with nutrition, they will die. And that's exactly what's happening. We have several patients that just died because they're not.
All right, the UN Human Rights Office is talking about a pattern of Israeli attacks striking life-saving infrastructure. Do you feel that your facilities, your patients, are being targeted?
So let me just make it clear, and I said this before. Regardless of the political stance, regardless of the ethnic backgrounds, ideological, theological, whatever, I'm here for a medical mission, take care of patients, and it seems that we're not able to provide them with the care. Now, why this is happening? It's simply because there's a lot of restriction. Now, I leave it to the political, parties and to the United States and UN and other agencies, international and national, to look into the reasons behind that. If you want my personal opinion, I think it's very clear, and it doesn't need to be even questioned or asked. So, in a nutshell, there's significant restriction on things to come in, basic supplies, and we're not talking about sophisticated equipments or sophisticated supplies. We're talking about basic food, water, basic healthcare needs, diapers. We're talking about nutrition for hospital patients, anesthesia equipments, surgical equipments, supplies, gauze, gloves, gowns. I don't think there's any question about the legitimacy of these needs, but I leave it up to the politicians to figure out why this is happening.
All right, thank you very much for your time, Doctor.
I appreciate it.